Hi, I'm Sharon Knight, President and CEO of Hope Communities. I hope you're having a good day and a good week. It's hard to believe that it has already been a month since this COVID madness started in Colorado. March 5th was the day that the first confirmed case in Colorado came to light. And at the 10th of March, we had a state of emergency across the state. And while there's been a stay-at-home order and more guidelines on how to stay safe, Colorado has already seen over 6,200 confirmed cases of the COVID-19 virus, and we've had more than 226 deaths so far. So it's serious business. We will certainly keep trying as hard as possible to help that curve to slow down or to flatten out. Hopefully we at Hope Communities can be part of that for you to help you understand the things that you need to do to help your families and yourself to stay safe. So unemployment is something that also has been, of course, surging across the state. Colorado had already seen about 127,000 people applying for unemployment, and they think by the end of this week there could be about 225,000. So certainly it's an unprecedented time for us, and we know that the people that we work with and our communities are struggling. So I want you to know all of the things, or at least many of the things that Hope has done to try to respond to this. So we were one of the very earliest organizations to call a moratorium on evictions, the eviction process, added fees and so forth for tenants. That is a hardship to us, but it's the right thing to do. It's an important thing to do. We went through a lot of steps to provide a process. So if some people who rent with us come to us and demonstrate that they've been affected by the virus, there are many defined steps to go through in order to get help for a delayed rent pay process for you. Again, the bills do not go away, but there's a delay in having to pay. So part of what the staff will do is to encourage any of our tenants who are in this situation to apply for emergency rents. We have a lot of different processes for that. We also beefed up our website. There are a lot of resources on our website that anyone has access to, and that is hopecommunities.org. We've distributed flyers in all kinds of languages that would be appropriate for our properties and the other clients that we serve. We also have information on the website that's in various languages. We've been reaching out to every resident and every frequent client on an individual basis to see how you're doing. We really want to be able to check in with you. This Facebook is one way that we're doing that. But we're also making individual calls. And in many cases, those calls are coming from navigators who speak a different language than English, if that's the one that you are most comfortable with. We have really increased our food distribution. We have several programs that are on our properties. There is going to be a weekly distribution at the Hidden Brook property on Wednesday early evening. We are not having people come into a food bank as they normally might have, or a food pantry, but to stay safe, to follow all the social distancing rules ourselves, and to keep our residents and our clients safe, we are preparing food bags and boxes for people who let us know that they have need in our immediate area by our property, and then being able to deliver those to households. We have been able to, fortunately, get some masks and some hand sanitizer that we're passing on to people who might need them. And we're working really hard with other community partners to leverage any of the resources possible for the people that we serve. Our navigators are really going deep in terms of navigation services. They're helping people to apply for the TRUA, the Temporary Rent and Utility Assistance Program. With that program, you may know that you need to demonstrate that you have 20% of the rent, and then TRUA would be able to provide 80%. And so part of what we need to do is to help people identify the 20% from their own savings or their own funds that are coming in on a weekly basis, or to find additional emergency rent sources to help fulfill that 20%. We actually have written grants, and we do have some emergency rent and utility funds in-house in Hope. And so we've also developed a process for rent and a process for utility assistance that residents can also ask to apply for. We are helping lots of people with unemployment right now. It is, as I said early on, there are a lot of people applying right now. So if you need to apply, you are definitely not alone. It is epidemic proportions. So it's sometimes challenging. So it's going to be tough for some people to make that application, particularly if English is not your first language, but that's why we have navigators who can help you to go through that process. And we do currently have navigators who speak Burmese, Somalian, Arabic, and they can be helping us to reach out to you to go through step by step what that process looks like. So, and one thing that I didn't mention the last time I talked about unemployment is that the state is waiving the requirement now to actively be looking for work, because of course many of the jobs that people who are unemployed would go after are not available because businesses are closed because of the epidemic. So there is no waiting week now with unemployment, and you won't have to demonstrate that kind of job search. When jobs become available, of course, you need to be ready too, but it's a little bit different right now. I know people are also interested in stimulus funds, and this is not something that navigators are specifically helping with, but any taxpayers will be able to access those stimulus funds coming in. If you filed electronically, then you should be able to get the money sent right to your checking account. And if you have filed for unemployment in terms of paper, then you will have to wait a little bit longer to get those unemployment checks or those stimulus checks to you for that program. Now, I should be saying that along the way here, please feel free to use the chat feature. I see that some people have already started to write in it. The great thing about this Facebook Live format is that if you do want to ask me questions during this process, you can just simply go on. Feel free to write your name there to say you're coming on to the show. And also, please let me know if you have any questions along the way. I'll try to answer them and respond to them as we go through, but if not today, we can get back to you later. We also have info@hopecommunities.org, which is an email open to anyone who has any questions, who has any needs. Please let us know for that. Now, this is going to be a challenging time for all of us, and we're going to have determination. We're going to have to work with intention and also positivity. And, you know, I think it's a natural tendency for all of us to want to have a secure situation, to be able to plan our days out, to know what's coming up. Uncertainty and a lack of control is difficult for most of us, and that is the situation we're finding ourselves in now. We simply don't have a lot of control about what happens around us in terms of this virus and this pandemic, but we do have control of ourselves and our families. And so I'm going to spend a little bit of time today talking about the things that we can all do to help keep ourselves healthy and a little more sane than we might feel at any moment during this time, because it is such a stressful time. And I think all of you know that stress not only affects the way that we feel, our emotions, our anxiety level, but it also impacts our physical health, and we need to keep that up. So I always start the show with a quote. Here's my quote today by someone who isn't as familiar as some of the others that I've quoted before. Resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it. You can do nothing but scream about it and scream about what you've lost, or you can accept and try to put together something that's good. That is by Elizabeth Edwards. And as I said, we're going to have to accept the fact that things are changed. And in some cases, they may not all go back the way they were. And so change is inevitable for us. Accepting the change and accepting this new normal, which in no way or sense actually feels normal, is something that we'll have to get accustomed to. And I think we're going to have to give ourselves a little bit of a break. For one thing, people who have never needed to ask for help before will probably need to ask for help. And I don't like to ask for help for myself either, so I know how that is. But I think one of the things we have to consider is that when we ask for help, someone is able to give us assistance, and that in itself helps them. So I think if we try to redirect our thought process a little bit and understand that there are lots of people out there who actually live to be able to help somebody else, and they're probably in the professions that can offer you the help right now. And so please realize that you're not creating a burden by asking somebody to give you a hand up right now. And then later on, you can do that for somebody else. So I just think we're going to have to accept that. So one of the things we'll have to do is also maybe recalibrate the fact that many of us focus more on what we can do for everybody else. Like I just said, some people live for that, and we don't always take enough time for ourselves because you might feel it's selfish or something like that. But if we can stay healthy and we can keep our families healthy, then we can help boost the immune system within your family structure and help the whole community be healthier as we each step into those responsibilities and those roles. So a lot of us are missing our health routines. A lot of us aren't able to get out with friends. So you got to think about a different way to structure the way that you maintain these things. And, in some cases, this could be a great way for you to even improve the way that you deal with health. There's another quote that a friend shared with me recently, that attitude is the difference between an adventure and an ordeal. So if we can shift our attitudes a little bit and realize that, yes, this is some kind of a new normal, that things are not going to be the same, that we are in our households and not able to do what we used to do, but we can learn a lot of new things, then that might be really helpful to you. So we're going to share some activities here that may be helpful for you, but also I really do want to encourage you, if you have some ideas about wellness or things that people do in their home, please use the chat feature. Fill us in on some of those. I mean, there's so many creative, innovative people out there, and I know that you are some of them. Thanks, Tom and Gwen and John, for joining. If you have any ideas about how people can help to improve their state of well-being, please write those in there. And you could do that even after this show is over. If you look at this when it's not live, people go back and look at this video. So write some ideas out there or share them on our Facebook in general. So I'm going to ask everybody to do something a little different again than we have done. And that is to take what some people refer to as a 10-second vacation. So we're going to try to slow down a little bit. And I'm just going to ask you to take a deep breath for 10 seconds. You're going to breathe in for 6 seconds and breathe out for 4 seconds. So why don't we do that? You keep doing that a little bit. Take a deep breath in and a deep breath out. You can listen to me with your eyes closed and continue to do that. I'm also, I am fond of a technique that is called the progressive muscle relaxation technique. And so sometimes if I am anxious at night or my brain is going a million miles a minute, and I'm trying to slow down to go to sleep, I will use that technique. And you might be able to do that while we're going through the rest of this show too. What that entails is tensing up. I start from my feet and move upward. So tensing my feet, just tense the muscles there for maybe 15 seconds and then just release it. So tense the muscles just in that one area and then release it. And then I move up to the calves and then I move up to the thighs. So just taking this time to actually methodically go through tensing the muscles and relaxing. And sometimes for people who just think way too much and you don't believe that you could step into meditation or something, or even yoga, doing something like this that is very methodical can be helpful for you to go step by step to relax those muscles. And most of us hold a lot of tension up here. So by the time you get here, you may need to do it several times. You may need to do the whole routine a couple of different times, just to make sure that you start to let go some of the stress that you've been hanging on to. Of course, the shoulder rolls are also a great thing to do just while you're sitting here. You can multitask. You can listen to me and also take care of yourself. In fact, I'm going to suggest some other things that you can do while you're multitasking. I mean, sometimes when you're watching TV, you can do some of these same exercises, or if there's a commercial or something, you can actually like stand up and do some squats or do some push-ups or something like that while the commercial's on. You can do that while you're cooking. You can do that while you're waiting for laundry. There's all different times when you have those little lapses in time. You could use that just to do a couple of quick exercises. And if you have kids at home, that's a great thing for the kids to do as well. I know I used to do things like that with my son because he had a lot of energy. So sitting down for TV shows or whatever, the commercials, we'd get up and move around and do jumping jacks and do whatever to get that energy out. For us as kids or as adults, using that to get energy out, but also to do exercises that could either relax us or firm muscles would be a really great idea. I also think, and I've said this many times, getting outside for even 15 minutes a day is really important. It's really helpful to feel the sun on your face. It's really important for you to have vitamin D. That really is a nutrient that helps your health and the functioning of your immune system, which right now we want very healthy immune systems. Sleep, of course, and good nutrition, which I'll talk a little bit more about later, is also super important. Sometimes you could set a mantra for yourself. Some people use affirmations where they identify something, a goal that they want to work on, and the affirmation might go something like, I am thrilled to death that I've been able to maintain social distancing so that I'm doing my part. So you are saying in the affirmative, as if you've already achieved it, the thing that you really want to keep working on, keeping those goals foremost in your mind. You might also just say, I am strong, I am resilient, I know I can get through this. And so something like that you can just keep saying over and over. It's kind of amazing how saying simple things like that can reframe your attitude. And as we said, attitude is really important at this time. I think having people to talk with is important. We talked about the Zoom conference call feature or the FaceTime that people can use with friends that they have. There's also some very nice apps out there. There's one that's called 7 Cups, and that is at 7, like a numeral 7, cups.com. And there are trained professionals who can offer support to you through that app. So people who actually understand the psyche and understand the trauma and the things you might be going through, they're available to talk with you. If you are past talking and you want to be doing something, there's some really great, I think, wellness apps out there. I the one of them that I like is called myfitnesspal.com, and it's actually a program that's run through Under Armour, which is a clothing company. But they have a lot of they have wellness activities. They have some really great fitness classes, short-term fitness classes that you can participate in. They have a food tracker, which is really great. So you can keep track of what you're eating, how much you're eating, the nutrients that you're getting, how you're hydrating, all of those things, and it's super simple. You can also track your exercise on that, so you track your calories that you are taking into your body and the calories that you're expending. It's really been a great app for me to use. I really like the holistic nature of it. Most of the health insurance companies also have great wellness things on site, and I think they've really bolstered them recently. I belong to Kaiser, for instance, and they've got many classes online. They've got a lot of, so the classes might help you with a personal goal that you have around fitness or around nutrition and so forth. They also have some meditations and some informational sessions that you can key into. They have some things about diet. They do have some fitness classes also. So I know United Healthcare does. There's other groups that have these online. So if you have health insurance, you might check out the website for that group, because people are, and organizations and companies are going above and beyond to try to help you through this. And actually some of them always had some of those features, but they're even doing more now because they know that we really need it. In terms of eating, many of us will eat more because of stress. Food is comfort, and also because we're home. Most people are working from home around the food, so they might eat more or might not eat the appropriate things. There's just never a more important time than now when you want to really focus on staying healthy and keeping your immune system up, to focus on what you are eating, to make sure you're getting appropriate nutrients, to make sure that you're not having too much sugar, too much alcohol, too much salt. And I know there are people out there listening who have dietary restrictions, and this is not a time, no matter how stressed you are, to let go of your regimens around that, because you absolutely need to stay healthy. So you want to try to get your proteins, your fruits, and your vegetables in whatever way you can, and to cook those well. As a matter of fact, I think this is a great time, if you have not been a real cook, to dive into something like that. We're going to do a future session on that. There's a lot of people have started to embrace the sense of baking bread or making new food or teaching themselves or their kids how to cook. It's a really great time to try to do that. And if you're worried about having enough food, period, never mind cooking, again, just reach out to us and let's see if we can help you to meet some of those needs, because we want you to have enough food and we want you to have the right food so that you can take care of yourself. In terms of some of the fitness things, we've mentioned some, but there are lots of those apps like the myfitnesspal.com, but also if you have belonged to a gym like Lifetime Gym, they have a lot of online classes. I mentioned in our last session that some of the dance companies are doing fitness and dance classes online. So there's ways that you can jump into that. And jump was a good word for that, because even if you can't find an app that you like, you can dance around your house, you can jump, you can do exercises. If you need some tips on that, on what kind of exercises you can do and you can't find them yourself, let us know and we can get some to you. Meditation, as I said earlier, is not for everybody, but it can be such a magical and wonderful tool to help relax you. If you could do this whole combination of your stay-at-home regimen, doing exercise, getting outside once in a while, and then also feeding your soul by doing some meditation, that would be incredibly helpful for you. We have talked about one of the sites which has meditation daily, which is called the 10% Happier site, and that is 10%.com is the web address for that. One of my staff members actually told me that they have a meditation session with a Jewish grandmother. She said it's like getting a big hug by a Jewish grandmother. And so she said it was really incredible. But we also have a site called Stop, Breathe, Think. And the website simply is altogether stopbreathethink.com. So they have all different types of meditation for you. And, you might just want to try it for the first time if you've never before. Lastly, on these activities that we're offering today, we feed your mind. There are lots of classes that are for free online now at all kinds of colleges and universities. There's other classes that are not educational in nature that you can take. There's virtual tours at lots of different places. So do things to use up your energy and to expand your mind. Don't spend your time listening to the news all day. I wouldn't listen to it more than an hour a day. Really would not go there because it's just too stressful. But if you could take a class or do something like that, I think that it would be really, really fun for you. At the last Facebook Live show that we did, we listed a lot of different websites, and not only did I talk about them, but they were listed in the comments section on the side of the Facebook Live page. So you can go back and check those out if you want. And speaking of fueling and expanding your mind, I always do like to talk about a book. And we had a wonderful book review last time by Lori Zeller. This time I'm really thrilled to announce that we have a book review that I'll be posting on our Facebook page in just a couple of minutes. And the book review is by Helen Thorpe. Helen Thorpe is a journalist and actually a former First Lady of Colorado. She has written 3 books to date in the last few years, just like us, Soldier Girls, and this one, The Newcomers. And The Newcomers focuses around refugee students that she got to know in Denver. And so it's kind of her insight into their lives and what it means to come to this country. And part of it, I think she talks about their resilience and their ability to overcome obstacles. And, I think it may not be a better time for you to be inspired by some of these young people who have now gone on since she worked with them to do amazing things. I think all of us can get through this. All of us can nurture ourselves in a way to keep us healthy, to keep continuing to grow our mind, and we will also be resilient. And getting inspired by another book will just be one of the tools in your tool chest to help you to get there. Before I go, let me just say 2 things. If you would like to do a video review of a book for us, please let me know. We are getting some really great people who have volunteered to do this, and we'll be showing some new books for every session that we do here for our Facebook Live. So there's some really, really great talent that you're going to get to see, but you could be one of those. We'd love to feature you on the video. It's a simple phone recording or camera recording that you send to us, and then we can get that live. The second thing is, if you have any questions, and I've said this before, or if you have any needs that we can help you with, please send them to us at info@hopecommunities.org. We're doing our very best to respond to you because we want to check in with you. We want to make sure you're okay. We want to help you to get through this period stronger than ever. So let us know if we can do that. And please have a wonderful weekend. I hope you try some of these things and that you are doing the first step on your track to a healthier, happier life Please be well. Thank you.